There has been a spike of confirmed COVID-19 cases imported from abroad, especially from the United States. The Korean government has therefore decided to test all arrivals from the United States for COVID-19 starting today.
A cocktail bar in Seorae Village, Seoul. 5 COVID-19 cases were reported here. The infection supposedly started when a flight attendant, the bar owner's spouse, traveled to the U.S. last month. The bar owner, an employee, a customer, and his friend were all infected. The internet cafe and private academy where the infected individual had visited were all closed due to cluster infection concerns. As secondary and tertiary infections spiked in addition to primary cases, quarantine authorities decided to expand the scope of test subjects. The new rule is this: everyone entering Korea from the States will be tested for COVID-19. Korea began enforcing it at midnight Monday. Those showing symptoms at the time of entry are tested at the airport quarantine facilities. Even asymptomatic passengers must get tested within 3 days of arrival. They should still isolate themselves at home for 2 weeks even if they test negative.
미국 자체에서의 지역사회 위험도가 계속 증가하고 있는 그런 상황이기 때문에 미국 입국자에서의 감염 위험도가 좀 더 증가했다라고.
Until March, most imported cases were from Europe. But since this month, there's been a spike in COVID-19 patients arriving from the States. The increase becomes clearly visible if the time period is narrowed down to the past 2 weeks. People from the U.S. accounted for nearly half of all confirmed cases. Seoul and a few local governments with a high number of returnees from abroad have already been testing all arrivals. Authorities project the number of tests won't spike all of a sudden. Also, starting today, no visa entry restrictions will be expanded to 90 countries or regions. This measure is expected to greatly reduce the number of people entering the country for short-term stay and eventually lessen the need for facility quarantine.